Good morning. Let's try it again. Good morning. One more time. Good morning. All right. I'm Andy Peterson. Welcome to today's Policy Summit. This summit is about you today. It's not about us. We obviously have an opinion as the chamber, but we're going to present both sides of every issue. We're going to hear things that you haven't thought about or I haven't thought about. At the end of the day, you'll walk away with an opinion and you'll know why it matters. Well, it's going to be an exciting day. I've already said that. We're excited that you're here. We have some great food to serve you today. We have some great music today. You're going to have some great networking. But before we get going, it's always important to introduce the board chair. Now, folks think it's all about the team at the chamber. We got a great team at the chamber, but it really is about our board members. These folks volunteer their time, talents, and oftentimes donate money to make our organization work. We have a great board chair this year, one person who I have come to respect greatly. His name is Bradley Schlossman from West Acres, and let me introduce to you our 2016 GNDC board chair.
Good morning, everyone. My job today is to stay on script, and the good news is I'm the only one who's supposed to stay on script today. The Policy Summit is actually one of my favorite events that the GNDC holds, and it wouldn't be possible if not for our sponsors who have been scrolling behind me and on the sides here. So if you see somebody that you know that is a representative of one of these organizations today or later, thank them for their support of this event, and for right now, let's give them a round of applause. So what makes the Policy Summit fun? First of all, it's interactive. You'll get instructions as to how you can interact today, but it has great topics presented by leaders of the issues on both sides and moderated by North Dakota's leading news talk talent. Starting with Chris Berg of Valley News Live and the host of Point of View and North Dakota Today. Joel Heitkamp of KFGO, who hosts News and Views and has also 14 years of service to the Senate. And then finally, Scott Hennon of Flag Family Media, the host of the popular What's on Your Mind. So ladies and gentlemen, this is the A-team of political moderators. Not to be confused with the A-team of political moderates. I'm not sure they'd like that title. But finally, our MC for the event is none other than the award-winning news director and anchor of KXMB here in Bismarck, Tom Gerhardt.
Good morning, everybody. I was listening to that music. I've been in TV for 23 years, I think, and I was telling Andy that I'd kind of like that for our beginning of our newscast, that walkout music, get a big dry ice machine, that'd be kind of nice. I have to get a quad shot latte to get that kind of wake-up feeling in the morning. It's great to be with you again. As Andy said, it's going to be a great day. A lot of invigorating thought should take place. And a lot of great things going on if you've checked your programs. A few things I want to remind you of. If you remember, this is really interactive, and you can give us your opinions, show up on screen, ask questions. So as a reminder, to text GNDC to 22333, you can use the hashtag GNDCPS to join the social conversation. That's hashtag GNDCPS, and the hashtags on Twitter will be displayed on the video boards throughout the day. And the Wi-Fi password, in case you haven't seen it, is RAMCODA. That's all lowercase, RAMCODA for the Wi-Fi password. The survey questions, you can text to the same number, and they'll be displayed throughout at the end of each panel. And I'll remind you of these things throughout the day. Also, at the conclusion of today's events and before we have the governor's forum, there's the dinner, and you can get your ticket for the Enterprise Pack dinner throughout the day at the registration table which is to my right where you picked up your name tag. And the suggested minimum personal donation there is $50. So following the packed dinner, we will have, as I mentioned, the first North Dakota Gubernatorial Forum. And rest assured, all packed dinner attendees will have priority seating for that event that will take place a little after 6:30 tonight and will be broadcast by the KX network. So let's get our first panel going. It's on mental health. And I'd like to welcome to the stage the moderator for this event, Chris Berg.
Good morning. Thank you so much for being here. I've been walking around today, seeing a lot of familiar faces from last year. If it's your first time to this event, again, you've been hearing this a lot, but I think one of the things that really makes this event special, unique, and fun is the interactivity. So please, I'm not very tech savvy, but if you have some questions about how to text in questions or whatnot, just raise your hand. Somebody will come and help you out. But your points of view, your questions really make this a very, very special and unique event. So we're going to start today talking about mental health, behavioral health issues. Many of us have been hearing about the challenges with the opioid crisis, the fentanyl situation, the deaths that have been related to that, and obviously the impact that that's having on you as business owners and business people. So let's bring our guests up here to have a very, very powerful discussion about what we can do as a community and a state to really start to mitigate these problems and enhance your business. So coming up here to join us is going to be North Dakota State Senator Judy Lee. She's the chairwoman of the Human Services Committee, so obviously she knows this stuff inside and out and a great resource for us today. Also the CEO of Lutheran Social Services North Dakota, Jessica Thomasson, and West Fargo Police Chief Mike Reitan. So if you give them all a big round of applause, please, and we will get started. To all three of you, thanks for being here. They actually were on Point of View on Tuesday. We had a great discussion talking about, hey, how can we start to solve some of these issues that we face right now as a state? Some stunning statistics between 2013 and 14. We had a 125% increase in deaths related to overdoses. 51 of those were in Grand Forks alone. We've seen this incredible increase in heroin usage and addiction. So, Senator Lee, I want to start with you. And one of the things that Andy Peterson and I talked about was we've got a bunch of business owners here. I think Tuesday night we spoke more to the general public about this issue, but what would you say to business owners and business people about, hey, here's the issues we face, and here's what you can be doing as business owners to help solve these issues?
I think it's important to know that this is not just a human services problem. I know that I'm kind of identified with the Human Services Committee, but this is everyone's problem. Because as a very prominent North Dakota physician said last year, 100 years ago we used to lock up people with mental illnesses in the state hospital. Now we lock them up in jail. That is not an improvement. The phrase behavioral health includes not only mental illness versus mental health, but other kinds of behavioral issues which would include those affected by autism spectrum conditions, individuals with traumatic brain injury, a variety of other kinds of conditions like that. So it's kind of more of an umbrella. But the substance abuse area is an absolute crisis. So there are some alternatives we can speak about as we move forward here, some options, and the business community really needs to be involved. This is everyone's problem, and it's for everybody to solve together, and I know that in North Dakota we can do that.
So can you just give us some ideas, maybe some concrete steps when you say, hey, this is everybody's problem and what businesses can do to get involved? What would you suggest?
Well, I would imagine that some of you may have employee assistance programs in your businesses, and that is an extremely important thing, and they should be encouraged, your employees should be encouraged to use those programs. There are other options too, and perhaps Chief Reitan may tell you a little bit more about one of them with which he is involved. But the private sector does have a role here as well. You need a healthy workforce, but you also need to make sure that the families of the people who are working for you are healthy as well. And Jessica's going to talk a bit about some of that family trauma situation, so I don't want to step on somebody else's topics here because we kind of divvied them up a bit. But you can be aware of what these needs are. There's an opioid program that has been going on. We've had 2 in Fargo, there's been 1 in Grand Forks, there's another one in Fargo the first week in September. Bismarck, I believe, is organizing one as well. And the ones that we have had, and I've attended all of them, have been standing room only, and it's community people who really care about this. The whole point of this is for us to figure out, if we knew how to fix it, we would have fixed it. And so the problem is, how do you stop that person from trying that first hit? What is it that we can do? If one of you can come up with that idea, then you've won the lottery for the state of North Dakota. One of our biggest entry points, and not percentage basis, but one that one wouldn't have thought about perhaps, is kids who are having their wisdom teeth out. They end up having opioids prescribed for pain management. Some of them don't need any, and some of them don't need very many, but they're getting quite a few. And so, well, it must be a legal drug. You know, it's a legal drug, it's been prescribed. And then they post on Facebook they're going to have their wisdom teeth out, and they become targets for the people who have less positive motivations than we might wish. And so they can end up selling them, they can end up giving them away, they can end up trying them. I'm not saying that these kids who are having their wisdom teeth out are a big problem in our drug problem, but excuse me, in the 60s, 80% of the people who were addicted to these kinds of products started with heroin. Now, 75% of the people who are on opioids started with prescription drugs. And they've gone to heroin because it's way cheaper, because the market for prescription drugs is huge. We have 5% of the population in this world, in the United States, and we are using 90% of the opioids. There's something wrong with that picture. So if we had all the answers, I'd tell you. But there are some very good options to be a part of this community, and I want the chamber to be involved. I want business owners and employees to be involved, not just legislators. We can't fix it.
Jessica, I think she brings up a great point, and she used the word, how do we stop people from taking that first hit? But then she also spoke to, hey, a lot of times these are legal drugs that people are initially consuming, and as she mentioned, going to heroin because it's cheaper. And when we had our conversation the other night, somebody said, hey, now I'm a person with chronic pain, and I can't always get the help I need because of this situation. So your suggestions on how do we do a better job working with our medical community to ensure that MDs are putting opioids in the right hands and not getting in the wrong hands because they don't know who's going to get addicted?
I know that the medical, the medical community is actually working on this. They're much more careful about, or much more restrictive in what they're doing in their emergency rooms, because there is a tremendous amount of activity that has come from people coming in complaining of dental pain. Sometimes it's legit. Sometimes because emergency room staff are not professionals in oral health care, they can't tell if there's really a problem there or not, so they will prescribe a painkiller if somebody's really in pain. We need to treat that. I understand the importance of opioids. My husband had, as a result of cancer, an invasion into his bones, and without OxyContin, his last weeks and months of life would have been very miserable. We have very good pain management legislation in North Dakota that doesn't penalize people who are prescribing appropriately. But what we need to ask the medical professionals to do is to perhaps cut down on the number of doses that are provided in certain situations, to make sure that there's a regular intervention and regular watching of what's going on with these patients. But when somebody has a chronic pain problem, you bet we have to have those available. They are an extraordinarily important tool. No one should have to suffer either. But what's gone on is it's become a heck of a business. And so we also need to look at the importance of Medicaid-assisted treatment. There hasn't been any in North Dakota until very recently. Minot has opened the first methadone clinic. My first reaction some years ago was, well, we're trading one addiction for another. And that's real easy to still have in the back of my head. But methadone as an alternative, which is a daily dose for individuals who are getting off an opioid addiction, enables them to live at home, to have a job, to live a normal life. And isn't that what we want? We have a state with an extraordinary shortage of workers in every area of the state. Where I come from, there are thousands of jobs available in Cass County, and of a variety of sorts, and good paying jobs, and we want to make sure we have enough healthy people to fill them. The other thing is, and this is something that anybody who is involved in business and anybody who is a property owner of rental property, when somebody walks out of the penitentiary now, because the penitentiary is a place that does have an excellent drug treatment program. They walk out the door and they fall off the cliff because we don't have any community supports in place in North Dakota. There's no place for them to rent. They can't get jobs. A young man, whose name you might even recognize if I told you, last name, came to me just distressed in the last session. He had just gone to a job interview for a manufacturer with a manufacturer in the Bismarck area, and he has been in prison for drug offenses. And he's trying to get his life back in order, and he said, I went in for the job interview, a job for which he's qualified because of his trade skills, and they told me I have to be clean and sober and out of prison for 7 years before they'll consider my application. He said there are only 2 apartment buildings in this community that will rent to anybody with a felony on their record. That means all the people who are coming out of prison are living in the same places. It's real easy to end up hanging out with the same folks that you probably got in trouble with before. So I've been a landlady. I understand this whole thing about how do you make sure that they're compatible tenants in a building, but we have to have some engagement by the employers in figuring out how you can have some kind of opening for these individuals who are coming out, who've been in a treatment program, who've completed their probation, or they've been released from jail or prison, and they need to have a way to get back into society again. They will not only have a better life personally, but you will have, in many cases, some really fine employees. And there is data on the national level with some of the states and communities that are doing this, that it's been a very productive way to get people from coming back again into the prison system and to provide them with a better life and good workers.
Could I build on something
Please.
Senator Lee said and to speak to your first question of from that employer perspective? In our organization, we're an employer as well and a chamber member, and we think a lot about, I think one of the topics that we were hoping would come out of the discussion this morning is some conversation about mental health. And sometimes we think about it as something that affects someone else, but actually I think 70% of illicit drug users are employed, full-time or part-time, and just about 80% of heavy drinkers are employed, full-time or part-time. So people who are struggling with these issues, with addiction issues, are in the workforce. They are in your workforces. And if you look at the kind of the different incidents by occupation, it's anywhere from 5% of a typical industry workforce up to 15% of your workforce is likely to be struggling with an addiction issue. So it is a very real issue for employers when we look at productivity and people's ability to really focus on what they're doing, the costs of healthcare related to treating people with addiction, and not only the person in your workforce, but their family. And that's really where a lot of our organization's work comes. We aren't an addiction provider, but we oftentimes are helping families pick up the pieces of destruction that their family has experienced because of addiction, because of untreated mental health issues, and that whole spiral of things. So I think from an employer's perspective, it really is not about something else. It is about us, and it is about our workforce and our communities that we care about. And Senator Lee's comment is exactly right. EAP programs, which I'm sure many of you in this room already have and offer for employees, is a great thing. But there are also some interesting things we'll talk about, like things that I maybe wouldn't have thought about either. If you have an employee who's in recovery, for example, you have someone who has worked through their addiction issue, they're actively in recovery, sometimes one of the most important things that employers can do is to offer some flexibility in the schedule so that person can attend the treatment support that they need, attend the appointments they need, the same kinds of things we do for people with physical health issues, we also need to start thinking about in terms of mental health issues. And I think that is perhaps the paradigm shift that this moment in time is allowing us to look at. And the legislature has taken a lead, the business community has taken a lead, the faith community, there are people, the educators, everyone is trying to think differently now about, we have a pretty good sense of physical health, what we need to do to be well physically. We are, I think, just on the cusp of beginning to understand and embrace what it takes to be well mentally as well, and not seeing that as a sign of weakness, not seeing that as a personal failing, but in fact seeing that as part of our overall well-being and recognizing that if we don't treat that like we treat physical health, there are consequences to be had, which unfortunately Chief and others in law enforcement see very often as things do spiral to that.
But I want to get to this, so Chief, I'm going to get to you in a moment, but how do you do that? Because like Senator Lee said on Tuesday, you know, if I'm a diabetic and I'm taking insulin, there's not a stigma associated with that, but I think a lot of people feel like, hey, if I go to my EAP or my boss and say, I'm an addict or I've got this challenge or this issue, I'm going to get stigmatized and may not have the same opportunities down the road. So how do we begin to change that stigma and support these people rather than have a stigma around them?
You know, I think there is no one way that we're going to do it. We just have to, as a community, decide to think differently and to talk differently about this. And there are very real consequences for us if we don't. And think of it a little bit in terms of your children. I'm sure many of you in the room are parents or grandparents. You do your best to equip your kids to be ready for the things that they're going to encounter. And sometimes addiction and mental health are things that we're genetically predisposed to. There are things that run in your family, that you maybe have a propensity for experiencing depression at some point. If your family has a history of diabetes, you talk about that. You talk about the things that you have to do to try to remain healthy. We don't necessarily have those same conversations when it comes to mental health. And I think it is the simple things that we do where we decide that our mental health is not weakness. Having mental health challenges is not something that we need to be afraid to talk about. It is something that we need to talk about and to prepare for. And the thing that I think is also new for a lot of people is that the treatment that's available for mental health is evidence-based. We actually do know what works. There are therapies that make a difference. Some of them involve medication, many do not. There really are things that we can do to become well. But part of it is just making the decision and recognizing, and all of us, if we are honest with ourselves, know that there are mental health struggles, how we deal with the situations that present themselves, how we perceive the past and the future. All of those things are part of our ability to cope. Whether you have support services around you matters, all of those things matters. We just have to own that. We have to talk about it. And as employers, I think it's important for us to recognize the stigma and the fear that the workforce has around this, and be as respectful as we can about their confidentiality, their need for confidentiality. If they come to you and talk about their recovery, they may not be ready to talk about that publicly yet. And I think just having that respect for the conversation and for people's courage to talk about it is important as we begin to have this be more of a mainstream discussion. We also have the downside. I mean, I'm a lifelong North Dakotan. You know, we don't tend to talk about our problems. We don't tend to air our dirty laundry. We don't like to complain. We have a sort of a stiff upper lip, stoic attitude, which is it's an important part of our culture. But I think in this instance, it's a little bit different. None of us is afraid to talk about why healthy eating makes us healthy anymore. We're not afraid to talk about, you know, I really shouldn't be having this pack of French fries. It's probably not the best for me. We need to have that same sort of willingness to talk about our mental health. And that is just it's a change that's going to be slow, but I think is important to the discussion that we're having today.
Chief, here's a text that came in. Again, if you want to continue to text in questions or comments, please do so. But person says, so I hear there's this is a big problem, yet I'm not really convinced. Can you cite specific examples? You're out on the streets every day, at least your team is. Do you have some specific examples to show how big of a problem and issue this is?
Well, in 2015, the West Fargo Police Department responded to 397 incidents where it was strictly a mental health issue. Somebody was in crisis, a family member, a friend, somebody called in to report this person having an issue, 397 times. So more than once a day, we're responding to these type of calls. In 2016, we've had 242 similar calls. Mental health issue alone. That has nothing to do with the domestics, the arrests that we have on car stops, that people have a drug addiction that's fueling their behavior, whether it's other criminal activities such as a burglary or an assault. We see it every day, and that's part of the reason that law enforcement is so engaged in this topic, in that so much of what we see in our community is fueled by either mental health or chemical addiction and the lack of treatment for those ailments. And like was mentioned, this is a disease just like any other type of diseases, and we're looking for alternatives to what we currently are doing, because the common phrase is we can't arrest our way out of it. Prison or the jail should not be the largest treatment provider in the state of North Dakota. When 80 to 80% of the people that are being incarcerated have either a mental health or a chemical dependency or both. We need to do something different, and to treat them within the facility and not have other services available in the community or other options available in the community is a shame. Locally in the Fargo, Grand Forks, and Bismarck area, there is a group called Face It Together, which is an employee-based addiction peer counseling group. And you'll begin to hear more of it as they push more of the information out in the community. It's based out of Sioux Falls, and it's evidence-based. They have a number of practices that work very well. During the last legislative session, there was a law passed that required schools to do training in the areas of mental health and suicide prevention. So each year, the teachers, the counselors, the administrators have specific training relating to mental health and suicide prevention. I would implore that you do something similar within your organization so that you have an opportunity to recognize and rescue those employees that you have working for you. It's nice that many of us have EAP programs, and we typically talk of those. When the person is hired, it's in the handbook, here it is, go use it if you need it. And we never really support, encourage, or talk about that program much in the workplace. And again, that would be something that I would encourage you to do. Do yearly training on mental health and addiction issues. Make those terms common in your workplace so that they are not such a stigma or a shaming, because many of us are ashamed of any type of struggle that we face. We all want to be strong. We don't want to admit that we have any type of flaw or weakness. So just make that language common in your workplace.
Senator Lee, here's a question that came in. You can comment too if you want on what he said, but the question is this: how do we legislate issues that are social and family related? At what point do people need to take responsibility for their actions and choices?
Well, obviously, we can't legislate our way out of this either, but I'm a strong believer in personal responsibility. I certainly think that's true. But if somebody is chronically ill, we wouldn't tell somebody who is in diabetic coma that we're not going to take care of you because you shouldn't have eaten that pizza and drunk that beer. We're not going to we're not going to treat the same way an individual who is having some kind of really serious mental health or behavioral health issue. This is a big deal. What I wanted to mention, and this is following up on what Chief Reitan said, I talked to one of the people that I know well over at FM Ambulance. They had 18,000 calls in 2011, 25,000 in 2015. 1/3 are listed as psychiatric illness or substance abuse. It's $1,100 per call, and they only get reimbursed about half, because some of those, if they didn't need an ambulance, they don't get paid. The top 10 frequent flyers, the ones who call them regularly, the top 10 had 1,584 calls in that stretch of time, 91% for mental health or substance abuse purposes. They're using community paramedics now to help evaluate that. One thing to legislate, well, several things. Let me back up just, this has got to be really quick, I know, but 3 years ago, a consultant was hired by the state legislative council to help us find the access and availability to services all over the state. Well, the answer is we've got really lousy access and availability, and part of the problem is workforce. We don't have enough licensed addiction counselors and other professionals, including other counselors, psychiatric nurses, psychiatrists, psychologists. West of the line from Bismarck to Minot, I've been told there's one psychiatrist. That isn't going to cut it. So what we're trying to do is figure out how we can improve that situation. The legislature passed vouchers. There are 8 regional human service centers in North Dakota. They are the ones who've been providing Medicaid reimbursed mental health and substance abuse counseling. With vouchers, I'm going to use Valley City as an example. If you live in Valley City and you need counseling, you had to drive to Jamestown or Fargo. You have to have a car. You have to have gas for the car. If you have a job, you have to be able to get off. And it's a long time trip because you're going to be going regularly. So you may just not go. But with vouchers, they're going to be able to go to a provider in Valley City, and that provider will get reimbursed by this voucher in the same way. And so we're going to be able to spread out some of that in the communities that have the professionals available. The problem is we need more professionals too. But we have mobile crisis units. We want one in every region. We have one in Cass County. Burley County is supposed to have one too, but I think it's been delayed because of the allotment, but it may come, and it's kind of a triage group. So somebody from law enforcement, the ambulance service, and the Human Service Center is called when there's a crisis call, and they decide what's most appropriate. But the problem is if they need to go into crisis beds, we're short of them. And then law enforcement generally, or the ambulance service is the other option, end up transporting these people around the street trying to find a bed to put them in, and sometimes they end up coming back to jail. And as Chief Reitan said, they are now our biggest treatment professionals. That's ridiculous. So here's my point too. Our foster care system is overtaxed, not just because of kids who might have problems themselves, but with the children of people who are suffering from addiction issues. I would rather spend state money on providing community and peer support services for people who need it, and not have to spend that money on taking kids out of their homes because their parents are high or drunk. And alcohol is still the biggest addiction issue. So yes, there are things the state is doing and will continue to do, but it's everybody's solution that has to be found here.
This
I
is
say too that I think that question of personal responsibility really speaks to the goal that so many of us have, which is trying to get involved before it's a crisis. What we've been talking about primarily this morning is when things reach a crisis level, when someone is in the throes of an opioid addiction, when they are in a mental break where they need to call the police or the ambulance. But what we know is that the earlier you can get involved, the more likely you are to avoid the crisis in the first place. And there are some really great options for working with young families. There is not one family, I think, that our organization has worked with that doesn't want to do the best they can by their kids and for themselves. But sometimes it's being there at the right time early enough to give people the skills and equip them to really be prepared for what life throws their way.
This is for all three of you, because if you look at across our country right now, New Hampshire, Massachusetts, West Virginia, all of these different communities are having challenges with this opioid and fentanyl crisis. So the question is this, I'm gonna give you some context, and Chief, if you wanna start here, is there a proven system out there that's actually working to help mitigate and resolve these issues? And if you wanna bring into context, you and I spoke earlier this week, there's a great piece in the Wall Street Journal about what's happened right now with the Mexican cartels when you've got states out there legalizing marijuana, and obviously the Mexican cartels are like, oh wait, that just dried up all my business, now I'll just flood the United States with a bunch of cheap heroin, and now we see this problem exacerbated. Your thoughts on, is there a proven model, and if so, what is it and what do we do?
There truly isn't anything that's 100%, and what we have to do is bring all of our little pieces together to a collaborative effort to overcome the issue. And with the cartel refocusing their trade from marijuana that's been replaced here in the United States by the legal marijuana produced in other states, which is making its way into North Dakota, much more potent, 12 to 15 times more potent than the old ditch grass of the 60s and 70s. The fact that excuse me, lost my train there. But we need to have collaborative efforts and be able to refer people into services. And the problem is those services are not available for the chronically ill. And Jessica made the mention, the sooner that we can recognize the problem and get the person into treatment, or better yet, to educate them and prevent them from entering into either a drug addiction or having some sort of mental issue, the earlier we can recognize and treat that, the more people that we can treat for the least amount of money.
Senator Lee or Jessica, do you guys know of a proven system out there that's, I don't.
You know, I think all of us are trying to find the thing that will solve it and the thing that will work. And I would echo what Chief said is there is no one thing that's going to solve it. And it really is, you know, we've talked some about some people are genetically predisposed to be more susceptible to the power of addictive drugs. But sometimes people are addicted because they are trying not to feel anything anymore. They're trying to self-medicate. They're trying to numb themselves from the pain that is around them. And it's a very, I mean, it's not a new idea, but that notion of trying not to feel is really at the root of a lot of addiction. And we have been talking about when it gets to the point where it's near suicide, or it's a psychotic break, or it's someone that needs to be in treatment or in jail. But if you can really recognize that there are points in time when you can get at that root issue, which is giving people the ability and the skills to find healthy ways to cope, to find healthy ways to deal with the stresses around them, that is a proven method. It's not a silver bullet, but it's a proven method that will make a difference for a portion of the population. And don't feel bad about losing your train of thought. I did too when you said ditch grass. I always lose. I always learn new words when I'm with law enforcement, so I learn new phrases.
Senator Lee, if you have a proven system that you can share with us, great. But another question came in that I would love you to speak to is that it says, how do emergency rooms try to decide if someone has chemical dependency and just want a higher dose? Can't read that, of the medicine, if they truly are, I think, saying legitimately have some kind of chronic pain to help. And one of the things I've heard in the past is that there's such poor interagency or even maybe inter-hospital communication that sometimes someone who is a known addict or maybe has familial addiction issues, that's not being communicated through the records, and someone's getting opioids that probably shouldn't be.
Perfect answer is that we have a prescription drug monitoring program in North Dakota that is extremely effective. Every prescriber and dispenser is obligated to, or supposed, you know what, we've made it mandatory, but I think we're maybe going to make it, we've had it as volunteer, but I think it's going to be mandatory and it's going to be quick. We've asked the professionals to all develop their own rules, but it means that if somebody comes in, and the emergency room docs use this all the time, but other docs need to too, because people do doctor and pharmacist shopping. So if somebody comes into the emergency room, then that emergency room doc can log into the prescription drug monitoring program website, see whether or not that person has received any kind of medication at all that would be on these schedules, and where they got it, and all of that kind of stuff. So there is definitely this wonderful network. The Board of Pharmacy manages it. Senator Howard Anderson used to be director of the Board of Pharmacy. He was responsible for this being moved forward, and Dr. Mark Hardy, who's now the board executive director, is taking care of it now. It's a wonderful tool. So there is no reason for any physician or prescriber of these drugs not to log on to the PDMP and find out whether or not there's any history of use before. Now, it could be because they have chronic pain, but they're going to be able to do a little more conversation with the patient. And if you visit with some of the physicians who, particularly those who work in the emergency rooms, you will hear some very creative stories that they have been told about how things work. So there is an answer to that, and we have it in North Dakota.
Chief, if you'll speak to this, one of the things that Senator Lee said Tuesday night that shocked me, and correct me if I'm wrong, Senator, but 70% of the judges have thrown people in the pen because that's where they can get the proper treatment. But as she said earlier, then I get out of there, now I've got this felony, and I can't get a job sometimes because of that. So do we change mandatory minimums, one, and then to kind of tie some questions here together, it says there's not enough inpatient care after a crisis, families are in danger, and police can't do anything until a crime is committed. You know, I mentioned to you Tuesday night, there's a police chief in Massachusetts now who's saying, hey, if you show up and you hand us your needles and you hand us your drugs, we won't arrest you, we're going to find you treatment. So there's a lot packed in there, but comment on that, please.
A number of things that we do have an unintended consequence. When we go to the doctor and we complain about pain, they have a tendency to issue us pills, and they issue us many times too many. Well, now we have that in our cupboard at home, and we hang on to it. The doctor says use these over the next 15 days. Well, we hang on to them for months, years, and they're available for yourself to use at another time, or a family member or a friend to come in and take those drugs and use them. So we've implemented a program for taking back unused prescription drugs, and they're at the police departments, and the prescription shops have just started the yellow jug old drug take back program. Out in Massachusetts, where the police chief is set up, in essence, an amnesty box that allows people to bring in their street narcotics and turn them in and then ask for treatment. The issue that we have here in North Dakota is that we don't have that treatment readily available, or it's a long wait. So when that person is ready to go today for treatment, by the time their appointment comes around 30, 60, 90 days later, they're not ready to go anymore. They're back into their habit because they have not had treatment. We have an unintended consequence, and we have it right there in West Fargo, and it's called a crime-free housing program. And the idea of the program is to keep bad actors out of rental property. Well, if the property owner uses that as a screening tool above what the program really is about, then people that are felonies and nonviolent felonies are being denied housing. So we as law enforcement need to re-examine that program, because the unintended consequence are people that are coming out of jail, they've received treatment, they've paid their debts to society, they want to be employed, now they can't have housing. So again, many little pieces to this much larger puzzle that we need to fit all together, and you guys are a big part of it. How many of you have on your application, have you been convicted of a felony? And when somebody checks yes, what happens to that? Are there some things that you can do that, or some areas of your employment where that person would be able to be taken in? And if they do have a felony on their record, what is the impact to you? Obviously, if you have a federal contract and you have felons, there's some implication there, but maybe we need to look at our federal legislation on those matters and say, is that really necessary? And look to
Chief,
those.
you can speak to this. I'm a big believer that compensation drives behavior. And so we had this conversation as well, where you see some people in Bismarck. There was a gentleman here when Senator Hoeven had his panel about this issue, where a lot of people in law enforcement are saying, hey, jail is the best place for treatment for these people, but a lot of people in behavioral and mental health don't believe that. My understanding, correct me if I'm wrong, is that oftentimes the more drug arrests you get, the more federal money you get. So is that part of the conversation where they're saying, yes, this is great that we're throwing people in jail for treatment because it helps increase their budgets?
It's not about the money.
I'm not saying for you, but are there bad actors out there?
I don't believe that to be true. The cost to us to incarcerate people far exceeds anything that we would gain from the federal government. We do it on the budget. We do it on your dollar. Your city, county, and state taxes pay for these things, and there isn't enough federal money to make that a profitable thing for us.
Can I say something about that?
Yes.
All of the jails and prison cells are full in the state. There are 9 counties already planning to build new facilities or expand the ones they have, and 2 other counties that are exploring it. That will add 840 beds to our incarceration beds in North Dakota. That's a 48% increase in beds in prison or in jail. That, if we can instead see some of that taxpayer money that Chief Reitan's talking about, diverted into providing some treatments that may keep some of those people on. Bad dudes ought to be in jail. Chief Reitan agrees with that, or in prison. We don't want the ones that are violent, that are selling, all of that kind of stuff. But we have to figure out a way to cope with this. And the reason that somebody might say that jail or prison is the best place for people is because there is treatment in the penitentiary. There is not treatment in every jail. Cass County Jail and I believe Burley County Jail scan everybody who's booked for substance abuse problems, and the percentages are mind-boggling. Chief Mike Reitan may remember the number exactly. I don't. It's well over half, as I recall. But then the challenge is, because of the waiting lists in the Regional Human Service Center who would be providing the care, that they can't get any treatment. Even though here they are in obviously a confined environment, there's no way that they're going to get the treatment they need. So they aren't the best place because they're locked up. They're the best place because it's the only place that there is going to be treatment available as if they're in the penitentiary. And Leanne Birch, who is the Director of Corrections and Rehab, has done a really good job there. But it's way less expensive to have peer support in the community, allow people to have treatment while they're going to work, while they can live with their families. This breaks up families too. You know, that's a really big deal, and Jessica could talk even more about that. The trauma for kids doesn't just include addiction. We're talking about the trauma that schools end up dealing with because children have parents not only who are addicted, but who may be depressed. It may be a death in the family. It may be that there's been a lost job. It may be any number of things that create trauma for this child, domestic violence. And they come to school and they're not prepared to learn. They're not getting the health care they need and that they can get because there are programs to provide children's health care. And ultimately, they end up having big issues in school. And at the very worst, they end up threatening or sometimes completing suicide. So it's a whole lot better to intervene early, as Jessica said, I'm sorry. This is so insidious, it just spreads and has sort of, as a little girl said one day, intertwinkled with all of the other kinds of things in our living and in our society, employment, personal lives, family lives, that we have to figure out a way to stop it. It's the old adage about let's quit hauling the babies out of the river and let's go up on the bridge and get the troll who's throwing the babies in. I mean, we need to intervene however we find a way to do that, where the problem is originating. And there are many problems. It isn't just the opioid thing. It's other kinds of mental health and behavioral health issues as well. If we don't address them, that individual, whether they're a 3-year-old or a 33-year-old, they're not going to have a decent life. And we are, as taxpayers, if all you are is a numbers person, as taxpayers, we're going to be paying one way or another. If you're a person who just cares about the person, they're going to have a bad life. If you're like me and you kind of care about both, then it's obvious to me that we have to figure out how we're going to have a right balance here.
All right, let's say we got just a few minutes left to talk about some action items that business owners can walk away with. And Chief, we'll start with you, maybe something to the effect of, hey, as a business owner, here's how we can support you and you can support us. But if each one of you can take a minute, 2 minutes, and just talk about here's some specific action items as a business owner, I think would help mitigate and solve some of these issues.
Well, I think one of the things you need to have is a proactive employee assistance program that talks about education and prevention, and then have those monitoring programs of employees, watching your employee behavior. In the police department, we have a program that monitors officer involvement in particular types of stressful incidents. When we have too many of those stressful incidents appear, we have what we call an early intervention, where we bring the person in and we talk to them and say, hey, everything going okay? We see this is happening. Where are you at with that? So having those open communications with your employees, educating them on what drug addiction looks like, what it's about. Talk about it being an illness, and then look at the mental health aspects of it. Are you providing a healthy lifestyle for your employees? And then expand it beyond just within the employees' family there at work. Talk to them about their own families, because many of the employees coming to work to you or for you every day have someone at home that's struggling with either a mental health or a chemical dependency issue.
Thank you.
I think the chief nailed it. I think probably one of the most important things that we as employers can do is to create a culture in our workplace where this is something that we talk about proactively, that this is part of our, so many of us have wellness initiatives. We have wellness programs that have in the early stages focused on our physical health, because we know that has an impact on productivity and well-being. But it's maybe just creating that environment where it is, you're not asking people to spend all their time complaining at the Coke machine, at the water cooler. It really is just about making it an environment where your employees know that you care about their well-being, the well-being of their family, and you recognize that there is more to well-being than just our physical health. And then all of those other things, like having an EAP program. If you have health benefits that you offer to your employees, most often mental health and behavioral health services are covered in those plans. And so they'll have some access to treatment, along with then at the end, which we sometimes forget about, which is successful recovery. So once you've gone through treatment and gotten the assistance that you need, what can we as employers do to try and be flexible in a reasonable way that allows people to successfully participate in recovery? I think those are powerful things that employers can do every day.
Senator Lee, if you want to go down the same path, but also a great text came in that says, and I think this is kind of the hard thing to get because there's not a proven model. It says, hey, we haven't really heard What are the costs of what's happening with all this? And what are the outcomes that we're going after to try to achieve?
We don't have as much data as we would like to have. We don't have time to talk about the Health Information Hub, but it's a wonderful thing that we need to complete some work on. In order to collect data, we don't have good opioid data, for example. We don't know as much as we'd like to know about what the prevalence is. We're aware of incidences in certain areas. But I think what's important to know is that there's an awareness now throughout the state that this affects the whole state. It isn't just the East, it isn't just the West. In the olden days, people who used heroin were sort of those people. You know, it was an inner city thing. We never got bothered by that here. But now, this cuts across all socioeconomic characteristics. It's everybody. It's our neighbors. I mean, I know people whose sons have been lost from either alcohol, from the power hour, or from an opioid fentanyl overdose. That is a frightening thing to me. I want, these were not laid out on the table because it was suggested that I not do that, but I want you to know that there are 3 of these handouts on drinking and substance abuse that are out at the registration table, and it's really good stuff. If you would please go pick these up and take them home with you. Put them up in your workplace, pay attention to those, and then also there are several websites that I'm leaving that I've talked to Pam Cook about or emailed with her, and she's going to post them on the Chamber website. Take a peek at those too, because there are suggestions for employers as well. The point is, some of the things that we can do to help people not get worse cost way less money than trying to deal with both the social and ramifications and the criminal ramifications of letting things get out of hand. If I drink too much, my whole family is affected. If I am an addicted person, my whole family is affected. We have to stop that.
Can we give all 3 of these wonderful people a big round of applause for the contribution they just made in this conversation? Thank you very, very much. When we come back, we're going to talk about the tobacco tax, and one of the comments that just came in here says, hey, will the tobacco tax help fund some of these behavioral and mental health issues? So continue to ask your questions for our tobacco tax panel. I've also been asked with your text, please keep them kind of in a Twitter-style format, if you will, short and sweet, and we'll get to as many of those as possible. So if you want to grab a quick glass of water, we'll bring up our guests and get started in just a few moments. Thank you. Thanks, you guys.